Thank you very much for taking part in our 10 minutes with ILPN interviews.
But
Can you just shortly introduce yourself?
sure. So my name is Alexandra Lopez. I am a trained sociologist and I hold a PhD in social policy. I'm currently working at the University of Porto as a senior lecturer, as a researcher, and I am based at the sociology department.
So can you just shortly tell what you are doing? Um,
Yeah, I mean, like I said, I am basically a researcher. And over the last years, I have been quite interested in understanding care provision and care arrangements among older people here
mhm,
in Portugal, basically focusing on the Portuguese case that you might have already seen in the literature portrayed as a traditional familist model.
mhm,
And so I've been basically interested in understanding the decisions, the preferences, the financials
mhm,
among older people and their families when the time comes to organize for care provision.
mhm. Can you just also say what actually long-term care is in Portugal? Because as you know, like long-term care means different things to different people and in
In the
different countries. Yeah.
Sure. Yeah. You're absolutely right, and maybe I should start precisely by that. I think similar to what happens in the UK, also here in Portugal, we don't use the expression long-term care that much.
Mhm,
It actually has been recently introduced in the vocabulary of all these issues.
mhm,
So typically, you will hear the expression social care rather than long-term care.
mhm,
And like I said before, although as a traditionally feminist model, Portugal is a country where family care, informal family care, still ranks very high in the overall
mhm,
game of care provision. We do have a social care system, a formal social care system, and it works pretty much like this. So it includes I would say that the typical services you find across most of the countries, ranging from home health
mhm,
care, nursing homes, day centers, night centers. What is characteristic about Portugal is how this system is organized. So
mhm,
you will find public provision and private provision
mhm,
of these services. The public provision, in fact, is quite marginal.
mhm,
The majority of the services are actually run by non-profit organizations, the majority of which operating directly or indirectly related to the Catholic Church.
okay.
Now, regulation and funding is secured by public funding.
Mhm,
It's the Social Security Ministry
mhm,
that is in charge of the regulation and the funding of this. Um, every year, there are these contracts, we name them cooperation agreements, that are signed between the state
mhm,
and these nonprofits,
okay.
defining exactly the amount of funding that will be transferred to the organizations, the type of services that will be provided. The care provided in these services is actually not free for the user.
Okay.
Uh, a co-payment scheme applies, and that is defined on a means tested basis. So you do have people
Mhm,
that do not pay
okay.
anything, but the majority will have to pay some user's fee. You do have some services as well in the private for-profit
Mhm,
sector, but those are targeting a very specific slice of the market, and they are, I would say, also quite marginal.
okay.
Another thing I would mention is, because social care can also come in the form of cash. We do have some cash benefits related to care. We call it the complement for dependence, kind of translating freely to English. So this is a cash payment that is paid to the older person over 65 years of age, person that is dependent on activities of daily living, and that is considered a first degree dependency, or that on top of this is also in a situation of dementia or bedridden. And this will qualify you for a second degree dependency cash benefit. Now, in theory, this is a cash benefit that is similar to what you find across many European countries. I think what is distinctive about this cash benefit in Portugal is the extremely low amount of money that is involved in the cash benefit. Just to give you an idea, this ranges from 90 euros, 90 per month, if you have a first degree dependency, to twice that amount, 180 per month, if you have a second degree dependency. But yet, this is just attributed if you don't have a pension that is over 600 euros per month. So it's pretty much what you find. Now, long-term care as an expression, like I was saying before, is a relatively new term in Portugal. In 2006, between 2006 2008, there was this new policy initiative that was baptized precisely as Long-Term Care Integrated Network. Still on. So this was basically a national system, a national coordination system that brought together social care and health care. So actually both social security and health ministries working together to develop this coordination scheme that will allow for proper, adequate provision of social and health care to people that are in a situation of dependency as a consequence of some chronic disease or a debilitating episode of illness. So I would describe this as a system of rehabilitation care along the lines of the care continuum model. This was very much motivated by the problem of bed blocking in hospitals. So it was, I think, a way to address that issue by creating discharge teams in hospitals. The referral to the system, to the network, is actually done either at health centers or hospitals. So if the patient fulfills the criteria for admission into this long-term care network, then he is referred to the coordination team that will try to locate a place in a facility that is equipped to fulfill the rehabilitation needs of that patient. The ultimate goal is always to rehabilitate as much as possible, to reintegrate, so that ultimately the patient can go back to his or her home, getting then on help if necessary. Now, this is relatively new. I think it's a very interesting policy initiative in a country with characteristics of Portugal, but it's still a relatively new system. The expansion is still limited, especially in the last few years with all the financial problems the country had to case, I would say it's still early to assess exactly what has been the impact of this.
Mm-hmm.
If it's enough.
Yeah, I am. Actually, I wanted to ask you about three main policy priorities about long-term care in Portugal. So you already said about some of that. Can you elaborate a bit more?
Yeah, okay. Yeah, I mean, if I had to identify three in a very short way, I would say that over the last years, the main priority has actually been implementing community care as the dominant model of
Okay.
care provision.
Mm-hmm.
And this has involved the investment in the expansion of home health services, pretty much
Mm-hmm.
across the country. This was clearly the chosen path.
Mm-hmm.
The second priority, which is somehow related to this,
Mm-hmm.
has been the implementation of this network of services, but in a manner that is cost efficient, namely in terms of the distribution of these services to tackle the territorial disparities. Although
Okay.
Portugal seems to be a rather small country, if you consider the
Yeah.
land, it is a very heterogeneous country in what concerns its landscape, the types of occupation of land. So there are still huge territorial disparities, which leave some parts of the country clearly with severe shortages of service supply. This has been a priority, I would say. The third priority, I think it's probably the recognition of informal care
Okay.
and family care, family carers, which involves not only material issues like carers allowances, which still do not exist in Portugal, respite care, which is still very, very shy in Portugal, but it also involves other issues, namely tax policy issues, labor legislation issues, gender issues.
Yeah.
So this has been also a quite relevant topic that we have seen addressed over the last years.
Okay.
Yes.
So in terms of research, what do you think are research priorities? What would be in Portugal? What would be one outstanding piece of research that you think would need to be carried out in a case of Portugal?
Well, I mean, taking the risk of sounding a bit ironic, but believe it or not, what would be critical in Portugal? It has been for some years, and I have been, believe me, I have been claiming for that for quite some time. What I think would be critical would be the implementation of some mechanism of regular data collection that will actually allow you to monitor care needs and care arrangements. Okay, we are still working pretty much on the unknown. Okay? There are a lot of things that we academics, but also policymakers, feel or believe they know about how care provision is organized, how families deal with care, about the financials of these care arrangements. But the truth is, no one knows. Now, if you want to be serious about designing and implementing policies, I mean, you need to start from the very basics. You need to know how much care is required. You need to know specifically the amount of unmet needs, the type of needs, the financials of older people and their families to meet these needs. This is uncharted territory, I would say. So an outstanding piece of research would actually be starting from the very basics and implementing such a monitoring system.
Okay. So my last question, I'm just going to ask you five quick questions, and I'm looking for a number of responses from 1 to 10. 1 is low, 10 is high.
Okay.
So the first one, what policy priorities allocated to long-term care in Portugal?
Look, right now I would give it a 4.
Okay.
And this is the result of the last years of austerity that have moved the attentions from long-term care to other issues, and within the field of old age, clearly to old age pensions. So you have been seeing like a long-term care almost fading away from the policy arena, and that's why I would give it a 4.
Okay. What about the public awareness? How do you think how much the general public is aware of what the long-term care system can offer them?
I would give a 5 to that. That is still quite a good amount of information that doesn't reach people.
Okay. What about supporting people with long-term care needs? How do you think the Portuguese system, how well does it support people?
I mean, in terms of quality, I would give it maybe a 7.
Okay.
The care is actually adequate. The problem is the coverage. It's the amount of care provided that leaves many people out. And therefore, I would give it a 5.
Okay. What about carers? How well the system supports carers?
This is, I think, the weak point of the system, and it's where we really have to work quite hard, and I would give it a 2.
Okay. And the last one, you mentioned the integration of healthcare and social care services in Portugal. It's quite high priority, but how well at the moment do you think these systems are integrated?
Look, adjusted to where we were coming from, I think this has actually been the area where things have evolved more considerably. So to this, I would give an 8.
Okay. Thank you very much. That was my last question.
My pleasure, Joanna. My pleasure.